Hi, guys. We are here. As promised, we have Dr. Melanie, Dr. Sasha. Let me play the intro, and then we will get right into it. Thank you, guys, for being here. Thank you for coming. And boom. And we're back. Hi, guys. Hi. So we have Dr. Sasha. Would you like to introduce yourself and tell them what medicine you practice so they'll know what questions to ask? And then Dr. Melody can give her little speech. I'm going to need somebody to turn their volume off. Okay. I can't hear you, Dr. Sasha.
Hi,
Okay.
I'm Dr. Sasha Stojanovic. I am a gastroenterologist that practices in the state of Michigan. I've been practicing for roughly 20 years, and I am board certified in GI medicine and liver disease.
Thank you, Dr. Melanie.
Okay, can you hear me?
Yes, I hear you.
Okay, well, I'm Dr. Melanie Stojanovic. I know many of you, been with Heidi a few times. I am an internist, so the practice of internal medicine. Sometimes people ask what that is. It's basically the person you go to when you're sick first, primary care doctor. Treat adults only, like a pediatrician treats kids. I treat adults. So I want to say I know a good amount of everything, but when something is not simple or out of my league, then I refer to a specialist. So if someone comes in with Crohn's disease, I know what it is, I can explain what it is, but I can't do a colonoscopy, and I don't do the management of it, and I would send them to my husband.
Okay. So, Dr. Melanie, I know you wanted to say something before we get started. Would you like to say it? Oh, I need to turn this off.
Yeah. We're so happy to answer your questions. And if we don't know the answer, we'll tell you we don't know the answer. But we are here purely for, to be informative to you and not to advise you what to do. Once we give you the information, if you feel you need anything further or treatment, or you may have something we speak about, please see your primary care doctor and follow up with them. We are not a substitute for them, and that's for your best interest. Okay.
Okay. Ooh. Okay. Guys, do we have our questions right? Well, I do. I have a question for you. Oh my God, we have my sister's in the house too. Hi, Sissy.
Hi, sis.
Sweet but kind of sassy is here. Butterfly Kisses is here. You can say you got questions, Butterfly Kisses. Say Natasha is here. Susan, of course, is here. Dizzy is here. Sorry, Beauty by KK is here. I think I said Butterfly Kisses. I think I did. Crazy Cat Mama is here. Kelly Hildreth is here. Welcome. Gwen Branston is here. Welcome, 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 welcome. Okay, my first question is now, Dr. Melanie, you know, you and I discussed this not too long ago. My cluster headaches, okay? I get really bad cluster migraines. What do you suggest I do? Besides medicine, because they're always giving me all of these pills, it just makes me sleepy.
Okay, first question is, there are cluster headaches and there are migraine headaches.
They're cluster migraine headaches. Cluster migraine. I mean, they start. They're pounding all the base of the neck, everything, face, everything hurts.
Okay, both sides of the face?
Yes.
Okay, well, cluster headaches and migraine headaches 90% of the time are on one side of the face. So I would first reevaluate the diagnosis, which is probably why the pills aren't working.
Okay, hold on. Let me tell you. So it'll start. Okay, like like when I tell you I can't lift my head off the pillow, and lights and everything hurt. It starts on one side, and then I swear to God, it gradually starts moving, and it's like, and then it gets in your neck and your shoulders. I'm serious. I cannot lift my head up off the pillow.
Okay, well, you said the light bothers you. That's called photophobia. That is usually very common with migraines.
Okay.
And do you get any, like, we call lacrimation, which is basically eye watering?
I get eye watering. I also get very nauseous.
Now that's also consistent with migraines.
Okay.
Do you get any, like, in a cluster headache, typically you'll get your eye will tear, your nose will run. This is all on one side though. So one eye will tear, you'll get a runny nose on one side. You can have up to like 8 a day, and they come. How long do yours last typically?
I can feel them coming because, like I told you, like if I go out and they're cutting grass or it's been raining, they'll start with the and I'm serious. I have an alert on my phone to tell me how high the ozone is or what the alert is. I can always feel them coming, like maybe a couple of days before. And there's an echo, but I can feel it coming a couple of days before. And then it's like I'll wake up that morning and I cannot lift my head up off the pillow. Just hearing my phone ring, anything, it agitates me.
Okay. There's something called migraine aura, and that sounds like what you're having prior to the headaches.
Okay.
So I would not give you a diagnosis of a cluster headache. I would say you are having migraines.
Yeah,
they may not be treating it correctly.
Well, that's what it called. I had medicine before, and I told you I had it because I get vertigo with it. I'll get if it's really bad, I'll actually get positional vertigo. And I told you this. They ran all the tests. My blood pressure would shoot up.
Pain will cause that.
Okay. All right. I'll get that. So I have that. Okay, I got that down.
So I don't know what they gave you.
Okay, there's an echo, baby.
All right. Is there still an echo?
Okay, say something else.
Is there still an echo?
Yes.
Okay.
Hi, dear Yvette. Okay, you guys, I want you. Okay, hold on a second, Mel, please. I want you guys to get your questions together. And if you want to come up on panel, you can come up on panel and speak to Dr. Melanie, Dr. Sasha. Or if you just want to put your questions in the chat, I'll put them up and they can see them. It's up to you guys. How do you want to do it? Yes, ma'am. I'm sorry, Dr. Melanie.
Oh, that's okay. I just want to know if you still hear an echo.
No, not right now. Not at all. You're good.
So let me just finish with you, Heidi. Right now, the best medications for migraines are either what are in the triptan family, like Imitrex, you might have heard of, is one example, or a calcitonin blocker, which would be like Nurtec, which is the new, is Khloe Kardashian as the commercial for it.
Yeah, so they had me on that, and I don't like it. It made me really queasy.
Which did?
The Nurtec. Yes.
The Nurtec's new. like real new? Did you?
I'm telling you, I got that like 2 weeks ago when I had it really
just
bad.
2 weeks ago?
Yes.
Okay. Yeah. Then, you know, there are other options to try for you. There are many, you know, that are sublingual, or you can spray up your nose, and that just works faster than swallowing a pill.
Ooh.
So you
Okay.
can, you know, go back to your doctor, just say you didn't tolerate that medicine.
I did.
And what happened?
She took me off of it and she gave me the same stuff. It's in my medicine cabinet. But you know what I find works? And y'all think I'm crazy. When I was little, I told you I suffered from this since I was small. My grandmother, I couldn't take the light or anything. She would get a hot washcloth, put vinegar on it. She would put it around my neck, and then she would put one on my forehead. And I'm telling you, it soothes it. It likes everything, and it makes you really, really sleepy. That always seems to help.
That's, you know, those home remedies sometimes are better, you know. So if that works, then use that.
Well, that's what I did this last time.
Yeah. I mean, if something works for you, I'm not going to say you have to take a medicine. So,
okay. Because the only thing it does, it makes me sleepy. I don't think it's helping my headaches. It puts me out of my misery for a while.
Right.
It just makes me sleep, and I don't want to sleep all day.
Well, it might be worthy to try one of the triptan medications, because Nurtex is not a triptan. It's a calcitonin blocker.
Okay. Well, I wrote that down. I spelled it TRIPTAN.
Perfect.
Is that right?
Yes.
Damn, I'm smart.
Ding, 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 ding.
I'm smart. Okay.
You're so smart.
All right,
I can't see the comments because they're too small on my phone. So could you read on that one?
Okay, so we have Sweet but Kinda Sassy. She said, I've had migraine since I turned 16 years old. I use, what is it? Sasha, what is that? For migraine prevention and massa salt, whatever packs to treat them.
Oh, metoprolol. That's, yeah. Oh, so you.
That's the beta blocker.
Yeah.
Oh, sorry.
Hi, Sweet but Sassy. Yeah, you must have had them frequently because you're on a prophylaxis for migraines. In other words, if you have like more than 4 migraines, that's kind of typically where we market. More than 4 in a month, 4 in a week, then we would put you on something to try to prevent them from coming. Okay. You know, if you have a couple a month, we typically use prophylaxis. So you're on a group of medications called beta blockers, and that's what metoprolol is, and hopefully you get them less than 4 times a week. But it's not treatment, it's prevention.
Okay, that's prevention. Okay, see, because I've been getting them, but mine only come at certain times, but I can always feel when they're coming. Okay, Dr. Sasha, I have a question for you.
Okay.
Do you see it?
I'm supposed to get a colonoscopy 1 year and an endoscopy next year. It is possible to get both done at the same time and just do them every year instead of alternating. You know, basically, some gastroenterologists don't want to do both the upper and lower endoscopy at the same time. That's really not necessary. Both can be done at the same time. You can get both done on a yearly basis. It depends on the condition, and it only takes 10 minutes longer to do a combination than a single procedure. Some GI doctors will try to tell you it's more dangerous, but it's really not. And if you don't mind, can you please share the condition that you are, both of the conditions that you're being evaluated for?
Okay. We have Dizzy Blonde. I'm going to say Dizzy Me Blonde again. She said, Um, does Botox really help migraines?
The answer is yes, sometimes. Some people get dramatic relief. Some people, nothing. It's worth a try, though. I think it now may actually be covered because it's not cosmetic treatment. So if you see a neurologist or an internist that injects Botox, then that definitely it's worth a try because when it works really well.
Okay, I see Lola says she takes, what is it, Tradol IV? What is that for migraines? I've never heard of that. Do you see it?
Toradol is IV. Yeah, that would be in the hospital. They'd give that to you. It's a strong anti-inflammatory.
Okay, that means she has them really bad then, right?
That she's ending up in the hospital. Yeah, she doesn't give herself IV Toradol.
Oh, I
IV.
just thought it was the name of the medicine. I'm sorry.
No, that's okay. No,
Okay.
Toradol is the name of the medicine, but it's only given IV.
Okay. All right.
And yeah, she said IVs.
Okay. Yvette she's asking a question. She says,
Hi, Yvette.
She says, I'm 48. Is it possible for me to still try for a baby, or am I too old? Girl, Janet Jackson had a baby past 50. Okay, I'm sorry, I'm not the doctor. You guys.
Yes, that my answer would be like, if you're healthy and you're still producing eggs, and you can carry the baby, it probably is okay. You would definitely be considered high maternal risk, or they call it advanced maternal age, AMA, but certainly not unheard of. But I would definitely discuss it with your OBGYN.
Okay, Snuggle Bunny just said, y'all might think I'm crazy, but I suffer oh, wait a minute. She says, y'all might think I'm crazy, but I suffer migraines because of MS, and chewing on drowsy Dramamine really does work. Huh. Okay. Now I buy Dramamine only when I thought I was going to get seasick when I would take a cruise, and I've never used them. I never knew that. Does that work?
I don't know that either. If it works, great, fantastic. And, for everyone may want to try that.
Okay.
Over the counter.
Okay, my sister says, for the last 2 days, I've been having Charlie horses in my feet. What causes it, and what can I take to stop it?
You want to take it, Sasha? You want me to? No. Okay. Well, the bad news is we don't know what causes them. We don't know what causes them in pregnancy, and we don't know what causes them other than low potassium or high calcium. And in order you'd have to go to your doctor to have your blood drawn. And I'm sorry, also dehydration. Other than those three things, we don't know the answer, and we don't have much of treatment. If you have low potassium, it's easy. We just give potassium pills. If you're dehydrated, we just make sure you hydrate yourself, and so forth. But the truth is, we rarely find those things. So,
okay. I put a question up from Butterfly Kisses. Dr. Melanie or Dr. Sasha, one of you. Do you see it?
I see it. I just can't read it.
Okay. I suffer from debilitating migraines from age 11 years. 11 years old until I was 30. The only 2 changes I made in my life: had my tooth tied and started taking Reactin, and been 14 years, not one migraine or headache even. I didn't know that.
What's Reactin?
She said, what is it? It's REACTINE.
Do you know, Sasha?
No, I don't know that medicine at all.
I don't either.
What is that, butterfly? If you don't mind. Okay, Gwen Branston said that she's trying to find a donor for my friend. Her blood type is O. I think the last time I think it's O positive. Can you help her in any way? Can you keep her in mind? Um, I don't know, Gwen, where does your friend live at? I remember you asked this the last time. Her friend has she is actually in bad shape and she needs a kidney. So I don't know. I remember you told her something about the donor. Sasha, do you have any way? I mean, not any way. Are you able to help her, guide her in the right direction? Remember, her family, the lady's family had already been tested and it wasn't a match, if I recall correctly.
Yeah. The best advice that I have is that she needs to see her nephrologist, and that nephrologist has to refer her to a transplant center where they can do the proper registry for donors. We do this for liver disease all the time. When somebody's liver is bad, I send them to a transplant hepatologist, and similarly, they're transplant nephrologists and transplant centers that do the complete evaluation, and then she's put on a donor list that is updated constantly. It's not something that one doctor can do around. It's a whole national registry.
It's a national list. Okay.
That is used by, usually they do it by regional sections or regional areas in the country. So if you're in Michigan, you are in the entire Midwest or in the Northeast region, and you can, if somebody unfortunately passes, they, kind of match up your liver, or I'm sorry, your kidney with somebody else's kidney, and that works that way. There's no, it's a entire national registry that really, there's no better way than that program. And, I don't know where she lives, but wherever she lives, there's a whole regional area, because you can't really do it across country. You can do it locally in regions, and it does work.
But it's odd to me that she doesn't know that. Does she? I mean, make sure she's seeing a transplant surgeon, and she's been told she needs a replacement, because she should know all of this. So I'm not criticizing her at all. I'm just want to make sure she's being treated properly, because she should be guided,
Okay, Sasha, that's a question for you. She's saying she has polyps for colonoscopy and endoximy due to growth they found that was not able to be taken out during my last endoscopy, as well as polyps. This is crazy cat mama. And then she comes down and she goes, she was referred to UCLA to have the growth on her esophagus removed, but never went. What?
We get it. Hi, crazy cat mama.
Hi, crazy cat mama. Listen, if there's a polyp that can't be removed endoscopically, by a standard gastroenterologist, there are two ways to approach this. One is to go to a more advanced center to get something called endoscopic mucosal resection, which is a special technique done to lift up the polyp, raise it, and then try to take it out endoscopically. This is a high-risk procedure. In general, it depends on how big it is, and it all depends. Everything in medicine depends on the clinical situation. So depending on how big it is and how advanced and where it is in the colon, sometimes it's better to just go to get it taken out surgically. And the surgeon can do, most of the time, they can do it laparoscopically, where it's only small incisions made in the abdominal wall, and then they stick a bunch of instruments in and isolate where the polyp is. If the gastroenterologist did a good job, he probably put a little tattoo around the polyp, or in front of the polyp and behind the polyp, so that it could get resected in case it was big enough or too big to be resected endoscopically. So, my recommendation for patients, and I do this all the time, and I'm trying to track down a patient of mine right now who's got a big polyp in the middle of their colon that I couldn't take out, and it needs to be taken out surgically. And so I would refer, as I'm going to do with my patient, I referred that patient to a surgeon who's going to hopefully do it laparoscopically and not have to open the patient. If you cannot get it out laparoscopically, that's the last resort, which is to make a big incision or a bigger incision and cut out part of the colon. And the good news is 98% of the time that can be cut out and then put back together in the same procedure. You don't need a bag. The risk of taking it out endoscopically is that somebody perforates your colon and then you end
hold
up
on. Sometimes Sasha forgets he's not talking to another doctor. Endoscopically means he's doing it while he's doing the colonoscopy. So if he's saying, that's what endoscopically means, just in case you didn't know, it goes endoscopic. If you can't get it out, to a surgeon who hopefully could do it laparoscopically, which is tiny incisions. That I've had a laparoscopic surgery, but I mean, you're out the next day and fine. And if it's just too big and they can't get it laparoscopically, then they have to, open you up. But I just wanted to clarify what endoscopically meant.
Thanks, honey.
Okay.
Got you back.
Okay. Go ahead, Sasha, finish.
I'm done. It's basically, if you can't get it out using the scopes, you have to take it out surgically. That's the best way to approach it.
Okay, so Gwen is saying that her friend lives in Arizona and she is registered, but they're just looking for extra help.
I wish I had a hand in that.
Extra help?
Just get her, if we could help get her higher on the list. Unfortunately, we can't, or I would. You guys are like our VIPs. So
okay, Sasha, that question right there is for you. That's a big one. Can you see it?
Do you need help, Sasha? Just kidding. I'm kidding.
They're great, but the Cologuard and which is the DNA test, the FIT, the FOBT, they're fine. The problem is, they're, essentially you can, for the DNA test, it's 95% effective. The problem is that means that 1 out of 20 cases is missed. Do you want to be that 1 in 20?
And excuse me, I have something to say. This is what I say to my patients who ask me this. I say, not only are, 1 in 20 missed if they are there, but if there is one there, if you do the camera endoscopy or the other ways, if there is one there, then you got to go get a colonoscopy to get it removed. So be safe. And I always say, go do the colonoscopy. I mean, you're not even put under, you're just given some medications that make you have the best sleep of your life. And, it's really, the prep is gross, but that's one day and it's worth it. I mean, none of my patients do anything else because I convince them. Now, I don't force them, but I convince them. And not because they're going to see Sasha, because I don't send everyone to Sasha.
Oh my God, you sure?
I'm positive. A lot of people have GI doctors already. Well, a lot of people just ask their internist everything. And, because we see them the most, so they're closest to us. And, they may have a GI doctor because they had reflux and they don't necessarily trust that they need the, then I always say, yeah, you do. So, yeah, if they don't, then I tell them they can see anyone they want unless they want to see the best one that I'm sleeping with.
Okay.
Thank you, Hunter.
Unapologetically curious is asking a question. Either one of you can take that one, I do believe.
Read it out loud.
You don't have to answer, but what are your thoughts about natural medicine like Reiki, acupuncture, etc.? From my standpoint, if anything works for you, then it's great. I always recommend people to see nutritionists. I have patients that have done fine with acupuncture, and alternative medicine has many benefits. There's no problem. Everything is whatever works for you. I mean, Heidi, you gave us an example of your grandmother giving you a towel with vinegar on it. No doctor is taught that vinegar on a hot towel will help migraine headaches, but if it works for you, it works, and that's great. So I am all for it. And honey, what do you say?
I was going to say, I agree. I myself have tried acupuncture. It didn't work. Some people have literally said it's cured them. We can't really comment on the remedies because they're not FDA approved. And as physicians, we can only recommend things that are FDA approved. But I can say, if you say, can I try acupuncture? Absolutely. And I've tried it myself. And I have used a natural medicine for constipation, and it worked better than anything over the counter. So if you want to try it and it works for you, go for it.
I have to say hi to Kels.
Hi,
Kels
Cal.
has been having Kels, put your questions in the chat. Kels has been having some medical issues, and I'm glad she's in here. Unapologetically is here, and I said hi, but I just waved at her. I want to say hi to her,
Yes.
Snuggle
Hi,
Bunny as
everyone.
well. My sister is asking a question, which I was going to ask you that anyway. Thank you, Edith. Love you. So my
Hi,
dad
Edith.
had major surgery. It was a year. In June, he had prostate cancer years back, and he took radiation that time. So this time around, he was falling and everything. His skin had gotten so ashen, he didn't look like himself. So my sister kept bringing him. This is when the pandemic was really, really bad. She kept bringing him to the hospital. And of course, he's not telling them what's going on. They kept sending him home. The last time he went, they kept him. She told them they had no choice, run the test. They found out he had the lesions on his spine. So his cancer had came back. So what they did was, this was like a 10-hour surgery. They put a rod in his back. They got it all. Well, so far, so good. The question is, what are the chances of his cancer coming back?
He had stage 4. Right, Josh?
Right.
Do you understand that the fact that it went outside the prostate and was found on the spine, that it was stage 4 now?
Yes, they explained that to us. Yes,
Okay.
they did.
Okay.
Yes, they did.
Good. I don't like when they beat around the bush and are not.
No,
Okay.
Seriously, the doctors were calling Edith. She would put me on 3-way the
Good.
whole time, do the surgery. They told us he's gone back for his checkups. I talked to him this past week. I asked them, what did the doctor say? He said, so far it hasn't come back. But it was like 10 years since he had the prostate cancer.
Was he getting checked every year in between?
No. Well, that's just it. He was, and I guess, and then he stopped. But now he has no choice because everybody is staying on him. But right. They actually put a rod in his back.
That happens, unfortunately, very often with elderly people, and especially male. Once it's gone, they don't always, once they hear you're good, they kind of drop off. And unfortunately, they should be checked like every 6 months instead of every year. But so it had a lot of time to grow, and it grew and it metastasized. So I can't ever anyone that will give you an exact amount of time is crazy. I mean, there are averages, and an oncologist might know that.
Yeah, but we were actually scared that because when they said stage 4, you know, my sister was saying, you know, she was saying that all his insurance was in order. I mean, we were thinking the worst, to be honest.
Okay, and and that's great that there's no signs now. But what is the chance of it coming back?
Yeah.
High. But when? I can't say. I mean,
Okay.
I don't think it will be 10 years from now. It seems to be rather rapidly growing. And even when they get everything out, there's often still microscopic cancer cells that you can't see by eye. So, but it's not tomorrow either.
Yeah, because after they put the rod and everything in his back and he went through everything, that's when he started the chemo. That's when he started all the chemo treatments in October.
Okay.
And he took chemo up until January, if I'm not mistaken. So far, so good. And I'm telling you, he didn't have any nausea. He didn't have any weakness when he was going through this treatment. He took this like a champ, seriously.
And is he walking better?
Oh, he's walking. He started driving before he was supposed to drive. He was sneaking and driving, and then he got caught. So he's doing a whole lot better.
Yeah, just you guys get on him, and make sure you know when his next follow-up should be, and one of you girls force him to go.
Well, see, okay, so he has my sister, and you think I'm bad. Okay. Okay, Jen.
Can I just add one thing?
Yes, sir.
You know, every cancer is different in terms of how it develops and how it spreads in the prognosis. So prostate cancer, which is stage 4, is not always as bad as something that like a pancreatic cancer that's stage 4.
Okay.
So even though something is stage 4, it may give you, there's no exact amount of time that can be given for any cancer.
Okay.
Period. But prostate cancer, they've got a lot of good treatments for it, and I'm not a urologist, nor is my wife. So
It's got to stay on top.
it's just you have to keep going because they've got the urologists have all sorts of tricks up their sleeves. Okay. And that's why you just need to do continued follow-up.
Yep. So we're staying on him for that. So they actually call my sister when he has appointments and stuff, and she makes sure that he gets to his appointments. So
great.
We're on top of that now. Jen 18, welcome. Thank you. She's a new subscriber to the channel.
Hi, Jen.
She has a question for you guys. Melanie, you might know her. She's in Johnny A's chat. She's moderated Jen 18.
Oh, yeah. I mean,
yes. Yeah, that's Jen. Yes. So she wants to know what works for quitting smoking. I've been using a vape, but trust me, it's only 3% nicotine, but I'd be dying for a cigarette and coffee sometimes, okay? She said she tried it all, including meds. I'm I'm desperate. Did not try hypnosis or acupuncture. Please help me.
Read the book called The Easy Way to Quit Smoking by Alan Carr. I think it's ALLEN.
The Easy Way to Quit Smoking. Okay.
It's like Ellen DeGeneres stopped via this book and was like, nothing worked for me. And I started recommending to my patients, and not every single one quit, but far more success than Chantix or any medication I can give.
I was on Chantix. Only thing Chantix does, seriously, it makes you sick to the stomach. You have to take it. The way the pills are set up, I have another box up there that I'm not even touching. And then, you still want a cigarette. It makes you sick in the morning. By the first 3 days, it makes you really sick. And seriously, you feel like you want to throw up, and you take it with your food and everything. But when Nathan was here, he started having me do vapes, and I like it, but every once in a while, I want a cigarette. But I've been doing pretty good.
You said
So,
your vapes, they don't have jewel pods, right?
no, these are just it's just this one is green apple and it's a flavor and it's just like 3% nicotine.
See, my issue with like the patch and people who use the jewel pods for vaping is that's almost worse than smoking. And the patch, the gum, you're trying to get off the nicotine with nicotine. So
I know, but it's not as much because
no,
yeah,
it's
but
better for sure. It's better, but your goal is you just want to be done, right? I just think the book, you just stop after, like you just stop.
okay.
And,
I wrote it down in the
free.
chat, and I just wrote it down here too.
Read it. It's
So,
not a huge book. It's easy reading. I've seen the book. My patients have brought it in. So that would be my recommendation. It's hard. It's
okay,
hard.
did you stop smoking, Melanie?
Oh yeah. Yeah. I mean, I'll
Okay.
cheat. If I have a cocktail once in a while, I might bum one from a friend or whatever. But yeah.
See, that's what I want to smoke when I'm drinking. That's when I want to smoke, or when I'm gambling. You're sitting there, you're like, need a cigarette. So I'm gonna see how this works. But I'm not going gambling for a while. Susan has a question. She says she wants to know about a reflex med. Melanie, what is that pen? What is
reflux?
It? Reflux.
That's what Sasha.
Okay.
Go ahead, Sasha.
Reflux medications have taken a lot of abuse over the past like 5 or 6 years. Actually, over the past 10 years, they, have been accused of causing all sorts of problems, including osteoporosis, pulmonary infections, problems with heart interactions with heart medications, dementia, kidney failure. But the main issue with reflux medications is that people don't want to admit that they work and that they have a good, solid place in standard medical practice. All of the claims that have been made over the past 10 years, really 10 years, but probably maybe 15 years, have not really been substantiated. Maybe some of the issues with pulmonary infections or with lung infections and with colon infections, maybe there may be something to it. The jury's still out with kidney infections, but the basic issue is that reflux, if it's serious enough that requires medication once or twice daily long term, also has a risk of esophageal cancer and stricturing of the esophagus, which causes difficulty swallowing. There is a very significant role for these medications to prevent those problems. And while I try to get all people off of the medications that I can, it's very hard once somebody started on these medications to actually take them off entirely because they work. And sometimes you have to combine them with other medications to make them work even better, because reflux is a serious issue. And if you've ever had really bad heartburn, not you, but anyone,
me, I've had it, and
it is a godsend for many people. And reflux, if the medications like pantoprazole take a little while to work, but Zantac, or not Zantac now because that's off the market.
I had Nexium for like 3 months.
Yeah, Nexium is the same. It's the same type of medication as pantoprazole.
Okay.
But fast-acting medications include Pepcid, which is over the counter and it's prescription. Tums, which is over the counter and it's been around for 100 years. And those actually work quickly. But what you want is long-acting medications to decrease the acidity of the stomach, and then you decrease the risk of changes. I do a lot of work on patients that have chronic reflux issues, and they have changes in their esophagus because of the acid, and those lead to esophageal cancer, which is worse than any of the side effects associated or claimed to be associated with the PPI medications.
Okay. We have Snuggle Bunny. Melanie, I think this one is for you. She says, I'm 43. How do you know you're premenopausal?
Basically, symptomatically.
Echo,
You,
echo.
Oh, that's me. Sorry.
Okay.
of course it was.
Okay.
As always, everything is my fault. And I accept it. That's why I've been married for 20 years.
Right. And I'm always right. It's real as far as perimenopausal or premenopausal, is mostly by symptoms. You would, hot flashes, vaginal dryness, night sweats. You're starting to get them. Your OBGYN can check for your hormones, and we check something called an FSH and an LH. And if they are low, especially mid-cycle, then that would be an indication. If they're high, that doesn't mean you're not, though. So it's really, now once you're menopausal, and that means not getting your period for a year straight. If you don't get it for 3 months, or 4 months or 5 months, then you get it, we still won't call you menopausal. We would say perimenopausal. But hormonally it should show up. So I would take it, if you think you are, got any symptoms like that, I would check with your OBGYN.
Well, I had my right ovary removed in 2007, and I was having, and Melanie, I'm going to tell you this, and you're going to think, and I was told this once before. So I was having like really bad cycles, never had them before, never. Legs were weak and everything. So when I went, they told me that I had a cyst on my ovary, but it was on the right side. But my left side was the one that was always hurting really bad when I was starting my cycle. And I've never had any kind of pain, no nothing. They should be 3 days, at the most 4. They started lingering to 7. So when I went to the doctor, and if y'all watch Angela on 90 Day Fiance, when she had to go in to make sure it wasn't cancerous, they go up there, you already know, and do the snip. That, I don't care how much they say they numb you, you feel that. So when they removed it, everything went away. When I started, I never had menopause, I never had cramps, nothing like that. But one night I woke up and I was in pure sweat.
Yeah.
2 nights in a row. So that was a part of menopause, which I thought, because I had my ovary removed, no more cycles, I would never go through that. But it only happened for 2 nights. I've never had hot flashes or anything.
Some people get very lucky.
Yeah, my sister had her whole reproductive stuff. She had a full hysterectomy, and she started having hot flashes when she was like 36. I mean, she'd be dripping, sweating. Oh, I've never had that.
At 30, they didn't put her on hormones?
I'm serious, 36, 37. She started having hot flashes really bad.
Yeah, they threw her into menopause. But usually at that young age, and at that time, how old is she now? Like in her,
let me tell you, but she's like 40.
in her 40s?
She's 40.
Late
yeah,
40s?
She's in her mid 40s. Yes.
Yeah. So that was, well, like not that long ago, 11 years ago. But yeah, I don't know, that would have to be a decision, because now we know that we really don't give hormone replacement therapy anymore for We used to give it to prevent heart disease because whatever. Anyway, it turned out we found out that it can cause breast cancer, and it doesn't.
Okay, so
even
is
help.
it common for after a certain age that women get vaginal dryness? I'm asking Sasha, close your ears because I haven't experienced that. I'm just asking.
You realize that he's been through internal medicine, OB.
No, I was being funny.
No, I know, but like people will be like, I know this is gross, but like my bowel movements, I'm like, we talk about shitting over dinner. That's what he does all day, is take care of people with shitting
Well, I was
issues.
going to ask you a question with that because I have constipation sometimes so bad. And then when I have to go, it's like I break out in a sweat. I got to take everything off. That is not good. And I've tried taking fiber and everything. I don't know. My system is horrible. It really is.
A lot of people's is. Have you tried Miralax?
Whatever it was, my mother told me to try. Was it Miralax? And I tried doing the extra fiber stuff. And I eat a lot of fruits. I don't eat a bunch of junk. I eat a bunch of vegetables. I just can't. But I'm going to tell you when I know that it's bad is when I'm really bloated. I go get me a nice bottle of wine and I just drink wine all day and everything just breaks loose.
Yeah, that does actually. Alcohol that's not a great remedy though.
I know,
now,
but
let
that's
me
what
ask
works
you a
for me.
question that I guarantee you're going to say no to, and then I'll yell at you later.
What?
Did you get your colonoscopy?
No, I didn't. Let me tell you why I didn't.
No, don't tell me. I don't want to hear your excuses. And
It's not an excuse. The doctor was a freak. This is the same guy that
There's
operated
more than
on
one GI doctor.
I know, but he
I'll
just
make a
told me
house
how pretty
call.
my uterus was. He kept talking about how beautiful my uterus was, and he made me really creeped out. I know. I have to go get it done. I will.
Well,
I'm
that's
going
not
to get it done.
that was
That's
your
a GI doctor
OB/GYN.
telling you how nice your
Yeah, why
uterus
was your
is?
No, so what
GI
happened
doctor in your
was-
vagina?
Okay, so when I had the surgery in 2018, when I had the emergency appendectomy, okay,
Yeah.
he's the doctor that performed the surgery. So I
Right.
went back to him, and he does he does it all there. That's his practice. He kept telling me how beautiful my uterus was. This man creeped me out. He was always touching my hand, holding my leg, and I was like, "Yep, cannot come back to him no more."
And something's wrong with him.
Yeah, he creeped me the hell out. And I was supposed to have my appointment with him to go get my colonoscopy done, and that was a no-go. I wasn't doing it.
What he is a colorectal surgeon that took your appendix out.
Yes, he took my appendix out.
Yeah, only a colorectal surgeon can do GI doctors and colorectal surgeons. So he had no reason to look at your uterus.
I'm just telling you. He was talking about it. He was inside, and he was telling, and that's when I really knew I had to stop smoking too. He told me I turned blue on the table, and they had me on oxygen. Like that whole day after surgery, I was on oxygen. Not the whole day, but most of the day.
My.
Find a different doctor.
Yes.
I am. I know. I got to go to another doctor. But everybody is talking about Chantix. Chantix it makes you anxious. It makes you sick.
It made you anxious and sick, though. Just to be fair.
Well, look what everybody is saying in here. This one, somebody said that she thought she was going to have to kill her husband when he was on Chantix.
Many people don't like it, and but there are some people that quit. I mean, Sasha's aunt quit. She'd smoked for like 40 years, 50 years, and stopped with it. So I don't want it, but yes, for some people, not good.
See, and that's what Jen said. Not good. See, look.
But again, whatever works for you works.
Yep. See, look all of this. Chantix made me violent. Hubby said no more.
Oh my God. Can you imagine if I was on Chantix, Sasha?
Oh my God.
Yeah. But again, what I'm just saying, some things, don't work for people. Some other people tolerate it fine. I do have patients that have tolerated and done well with it. Probably more that haven't. But you are, especially since you're not regular, you need to see a GI doctor and you've missed your screening colonoscopy.
I know.
Okay. I
know.
said I'd yell at
Hi,
you later.
Nikki.
So I'll stop.
Nikki. Wait a minute. She said she did hypnosis and it helped her to quit smoking.
Again,
Okay. And she changed her
some people
habits.
help some people. I mean, I have a cousin who does hypnosis and helps people. I don't tend to ever get relief from naturopathic medicine. It's just, I think that's because I'm an allopath, but so I don't, but some people swear by it. Like I've tried acupuncture for things, but you should also go try Miralax. You probably tried milk of
Yep.
magnesia.
Yeah. Because that's what my mother told me to take. Did you see what Dorothy just said? She said, it's hard to quit smoking. My uncle smoked all his life, had a stroke, and went back to smoking again. And Dorothy, I understand. My grandfather was the same way. He was in the hospital. He had heart issues, and he wasn't supposed to smoke. I came down from Virginia for a visit. The first thing he said, he was like, "Babe, give me a cigarette." And I gave him a cigarette. Well, I gave him a couple. Didn't realize he wasn't supposed to have them. I went in my grandmother's house. I'm standing in the kitchen. My grandmother's in there. She was like, "Who gave Jack a cigarette?" And, I'm looking crazy. And she looked at me. He was rolling with one hand in a wheelchair with oxygen on the back and blowing smoke.
It's very hard. My mom smoked till the day she died. I mean, she didn't really have she would have lived longer if she wasn't a smoker. She did have, coronary disease. She never had a heart attack. But I know it's very, very hard. And you were just talking about Angela, and a lot of bloggers are like giving her so much grief. But it's really hard when doctor says you have to quit now completely for 2 weeks.
Yeah, if she's going to have any of the surgeries, she's going to have to.
No, I mean, and I'm just saying, I guarantee she's not the only one that sneaks a couple here and there. It's very hard. I highly recommend you don't smoke before surgery because it's not just bad for anesthesia. It constricts your blood vessels that would go, oxygen is in the blood vessels, and you want that delivered to the tissue that's been cut open to help with healing. So it interferes with wound healing. So there are many reasons not to smoke before, but I understand she's been smoking Marlboro Reds for like 50 years, and she's told like, okay, you have to stop now to get your surgery in 2 weeks. And she smoked a few cigarettes. Now, smoking on the way to get her surgery, that was fascinating.
Well, I think that was my problem too. I told you how that happened. I thought I had pulled the muscle, and it turned out, and I'm gonna tell you, I was in Maryland, got on the plane to come back home. This was over 4th of July weekend. Got on the plane to come home. I started having really bad pains. I'm thinking I pulled the muscle because we had walked so much for the days I was there. We went all over the place. And I'm just thinking I pulled the muscle. I told you I was on the floor in my bathroom, curled up in a ball. Got up that Tuesday, went to work, and I'm walking. Every time I was walking, I felt like something was about to fall out. By Friday, the pain, I said, if I don't feel any better, I'm going straight to the doctor. At 8:05, an ambulance was at my job and took me. I was in surgery by at least 10 o'clock that morning.
What'd you have?
I had to have that emergency appendectomy. The doctor told me I must have been crazy. He said if it would have burst, that would have been nothing they can do for me. He goes, he told me I made it there just in time. That's the doctor that took my weirdo out, was talking about how my uterus was so pretty.
That's really weird.
That is weird.
I know.
Can I make a comment about the smoking?
Yes.
A lot of it is what people have, in their minds and in their heads. I think it was Kelsey that mentioned that she stopped smoking without a problem when she had her child.
Yeah.
A lot of
she
people
she was pregnant
can stop smoking when they think it's going to do some serious damage, either to them or to somebody they love. which includes their unborn children as they're coming up. And so,
I think especially your unborn
especially in that
Oh,
situation.
Melanie, there's an echo because Sasha.
Oh, that's because I'm talking. So a lot of it has to do with your mindset in terms of quitting smoking. When somebody has, when somebody has a heart attack or has pneumonia or has some issue and they've been smoking, some people will quit right away and not have an issue or a problem because they know their lives depend on it. A lot of people, in a sense, don't really think that smoking is bad or they can quit somewhere down the line. But when you're put into the position where you're pregnant and you got to stop smoking because your child needs you to stop smoking, you'll do it. And so it's just another way to look at things.
Okay, see that's what's so confused because way back in the day they would smoke and they would be pregnant and then they started finding out all this stuff. But Gwen Branston said that Johnson & Johnson is back in the news again. They're saying that the medicine, I guess, is for the COVID. It causes neurological disorders. Have you heard about that? The Johnson & Johnson vaccine?
It actually just came out in the news in the last literally 2 or 3 days. And I personally have not read the literature, but as with everything in medicine, every medicine has a side effect. Have you ever taken a Tylenol to yourself or your audience? You probably have, but Tylenol can cause liver failure, liver disease. Aspirin, Motrin, Aleve, all of those medications can cause GI bleeds that can potentially kill you. The benefits of medications that we prescribe are usually, we do it with the hope that it outweighs the risks. Now, J&J vaccine has been under some scrutiny because of the blood clot issue, and now this new neurologic issue. And I will tell you, I don't know all of the data and the literature behind it, but it is a effective vaccine. You would have heard a lot more about it if it was a dangerous vaccine. The Pfizer, the Moderna vaccines are safe, but it doesn't mean that there are not side effects associated with those vaccines. Okay. Because every medicine has issues. But again, just like when we were talking about the PPIs, they do have some side effects. The benefits of the medication.
Excuse me, they
risk.
may not know what a PPI is.
I'm sorry. Medicines like pantoprazole or omeprazole
Nexium.
or Nexium.
Echo, Melanie. Okay.
But the important point to remember is that all of these vaccines, have been tested in the real world, and now, if not hundreds of millions of people have gotten them, and there have been very few side effects. Remember, in this country alone, 600,000 people died from COVID.
Yes.
And you can argue about the numbers, but think about all the people that die in a car accident every year. That's not nearly as many as have died from COVID. And that's just in this country, not worldwide. And so, yes, they're investigating the Johnson & Johnson vaccine, and that's fine. And, but I don't step away from the opinion that everybody should be vaccinated if at all possible. And I think my wife would agree.
I absolutely agree. Don't get me started, but
okay.
Yeah.
Okay, Melanie, this question is for you. Gwen says she's been having pain in her right calf at night and sometimes during the day. She forgets what it's called.
What?
Is it restless leg?
Gwen
is it restless leg syndrome?
I think that's what it is, then restless leg syndrome.
Otherwise, I don't know if it's a muscular pain. Usually with restless leg, you get like some restlessness and you're like, though, not just pain. Like it kind of, you can't get it comfortable. It can also have pain, but I'm not sure. And I don't know if she has
Oh,
a question about it.
Jen said her mom passed away from hormone therapy. She got breast cancer. Oh my God.
Yeah.
Sorry, Jen.
I'm sorry too, Jen. Yes, we used to give it to everyone who, for in menopause, and then a huge study came out. I'm so old. I want to say like around a few years ago, and no, it was like, gosh, I'd say probably 20 years ago, but um and it was just this huge study, and it was a large group, and it turned out that there was increased risk for breast cancer, and it didn't decrease the risk of heart disease, or what we called, it wasn't cardioprotective like we thought it was, and we stopped giving it to everyone. And then we had to go back, and it turned out that most people didn't get breast cancer for within the first 5 years, and within the first 5 years are when most people have the most symptoms. So if they had intolerable symptoms, some people don't just have night sweats, they have hot flashes that they can't work, it's so bad. So there are very few people you'll find on estrogen and progesterone therapy.
Okay, I'm sorry. So Gwen just sent me a question. Okay, she was talking about the Johnson and Johnson. She said my brother had the shot, and when he first got the shot, the next day he had problems walking. So far, he's okay now, but her brother was the one that was having the leg, the pain in his right calf, and at night and sometimes during the day. It was a continuing question. Sorry, Gwen. Sorry, I see that. Okay. So do you think that was caused from the shot or not? Probably not. Probably side effects.
From again, it's hard to say. I don't know what he did, who he is, what
Okay.
medical issues he's got. Usually, a reaction from a vaccine doesn't come the next day and then go away. It may stay for a little while, or it's very hard to say without thorough history and examination. How long ago was it? Is it gone now? If it's gone, a lot of people get transient symptoms from any vaccine, which may last a day or so, but they're very minor. Just like, the big complaints from at least the Moderna and the Pfizer vaccines are arm pain, flu-like symptoms, which will usually last a day or so, but people get over it and they move on. So I don't know in Snuggle Bunny's brother's case.
That was Gwen Branston. Branston. Snuggle Bunny has another question. Yeah.
I didn't see. I thought the same question was up, but I don't know what the particulars. That's the difficulty of this sort of forum, because you can't get an entire history to
give them a diagnosis.
To make a diagnosis. So you go with bits and pieces, and that's a little bit of a problem. But
I can answer Snuggle Bunny. That's ridiculous. I'm assuming you can't get an appointment with your OBGYN until August. If that's the case, I'd call back and make it very clear that you're heavily bleeding and concerned that you may be anemic. Now, if you say that you're like really dizzy and stuff, they're going to send you to the emergency room, and you probably don't need to go to the emergency room. But I also don't know how old you are. Sometimes the beginning of a perimenopausal symptom is a long period and then followed by none. But if they really just won't get you in, if you have an internist, they can at least make sure you're not anemic. And I mean, I do pap smears. So once my patients are menopausal, they call me their one-stop doc, because they don't really need one anymore. Now, if I find when I do a vaginal exam, if I find a cyst or what I think may be a tumor, then I send them to their old OBGYN or a new one. But that's really unacceptable. Maybe, that sometimes the secretaries that don't really understand, like,
Yeah. So
I'm
you want
sure
her to
your
call back
doctor,
again.
yeah, call back and make it clear and say, could you ask my doctor what I should do then? And they may say, oh, we'll get her in.
Ooh, Dr. Melanie, Crazy Cat Woman has a question for you.
Yes. Hi.
Dr. Melanie, as we women age, it is normal to lose our sex drive, right? For me.
Absolutely.
Okay, I will be 60 this year, and the last thing I want is to have sex. Whew.
Is it libido, or is it are you dry? Do you have vaginal dryness? Does it hurt? Or is it just I'm tired, leave me alone? Oh, I feel like I was waiting for her to talk to me.
Okay, Cat Mama, she wants to know, is it because you're tired, leave me alone, or is it because of vaginal dryness, or what?
Is it your libido, or you just don't have the urge? Or, your libido?
I think she says she doesn't have the urge.
And especially because we don't put people on hormones anymore, your estrogen level, which helps with the drive, is gone. So, I didn't want to be touched when I was pregnant. I didn't want him to look at me. So hormones.
Bad, Melanie, bad.
I gave him a whole 2 babies after that. But
that's not his problem.
What's not his
problem?
So
you were practicing, you were doing something to get pregnant, then you want to cut the man off. I'm sorry,
exactly
Dr. Sasha.
What you wanted me to do.
I'm sorry she did that to you, because that was so mean, Melanie. So mean.
I have to carry a baby, get fat, work, clean, and then also have more
about cooking.
I don't cook that much. I'm not gonna lie.
Stephanie says, hi, Stephanie.
Wait, one last thing.
Yes, ma'am.
If there's any bit of depression, which also increases as we women get older, very often a small dose of an antidepressant, not even so much used for depression. It's almost like an underlying depression that you don't know you have until you don't have it. Sometimes I'll try that, a low dose, and that it helps your mood. It helps you get in the mood a little more. So that might be something to think of too. Okay, what's next?
Okay, crazy. Okay, so Stephanie was just making a statement. She says she quit smoking. Her quit smoking remedy has been scratching her eyeballs out and wearing patches, kind of working. But I respect both allopathic and homeopathic practitioners working together. We can see miracles.
I agree. I do.
Okay. Cat Mama says that her surgeon is refusing to do her back surgery until she quits smoking. I just told you they won't, because you will turn blue on the table. You're going to have to stop smoking. You're going to have to stop smoking. If I would have known that was going on with me, I would have stopped. But the fact that I had emergency surgery, and when I had my ovary out in 2007, I was smoking, but not like that. But I had smoked on the way to work. I had smoked all the night before. I couldn't sleep. I was in pain. So yes, that caused my oxygen level to be really, really low.
Yeah.
Okay, and then
I mean, that's kind of a good surgeon, because most surgeons, they'll just operate. I mean, that's how they get paid.
Okay. Stephanie says, thank you guys for the medical experts here today. Bless you all. Thank you. Guys, we're going to get out of here in about 5 minutes. I don't want to hold the doctors up. So let's see. Can you straighten bunions out without surgery? That's coming from Natasha.
No. There are all types of.
Bone deformities. Yeah.
What?
Bone deformities.
No, I would say there are all types of like what do they call it? Gimmicks that or you stick this between your toe and tape it around. No, you can't. The bone needs to be shaved down. And a podiatrist can do it. You don't have to go to a foot surgeon.
Okay, and then Kels did. Okay, Kels is saying her brother has whatever Guadalupe bar.
Guillain-Barré.
Okay, so what's the cause of that?
Kels would know. What did he get Guillain-Barré from? Did he have a vaccine? Did he
She
have
said from an
meningitis?
injury. No, from an injury when he was younger that caused it. I'm sorry, Kels.
Oh.
I didn't read the whole thing. Sorry. Yeah, so he got it from an injury when he was younger. Okay.
So can he, you know, you can go from paralysis of just, I mean, I don't know what, I mean, that's horrible. And I'm so sorry, but I don't know, you know, there's a kind of a lot of different ways it can present itself, none which you want. I had a patient end up with paralysis of the lower extremities. That's so sad. I don't know if you had a question.
Can I?
Go ahead.
Typically, it is a complication of a post-viral syndrome. And again, I am not a neurologist. I have not treated a patient with Guillain-Barré's in 25 years, but the last one I remember, it was a complication of a post-viral syndrome. Somebody had a virus many years ago, or sometimes it presents after viral meningitis, and it usually comes a couple of weeks later with descending paralysis or ascending paralysis. It's usually ascending paralysis from the legs up. My wife corrected me, which she's right, and it can lead to temporary or sometimes permanent neurologic deficits, and that's about all I remember. As far as I can remember, I have never heard that it was associated with an injury, but I could be wrong.
Okay, I just saw one. Okay, here's Snuggle Bunny. She said, I personally didn't want a vaccine, but when my neurologist told me that the complications of COVID would be much worse than the complications from the vaccine, having multiple sclerosis, so I should get it. So she's just saying that her doctor is telling her to get this.
Yeah, I tell all my patients to get it, because the sickest patients really that I've ever seen in my entire life as a practicing physician have been the past year and a half since COVID came out. These are patients that sit in the hospital for 2 months, 3 months, and then die.
What was the question?
The question, somebody was talking about a vaccine and the complications for a person in the chat that had MS, that her doctor recommended the vaccine, and she got it because he said that the complications of COVID are worse than the complications of the vaccine. And, I personally recommend it for all my patients because, as I was saying, people sit in the hospital for months. Most people that get COVID will do okay and they'll do fine, but there's a percentage, and it varies depending on the type of virus and your comorbidities, or which includes your medical problems, that it ends up in a lot of patients causing long-term problems, and people are in the hospital. It's called
long COVID.
Long COVID. And people sit in the hospital for 3 months and never get back to where they were, or they die. And it's not a pleasant death because people are on ventilators or have tracheostomy tubes where they have tubes stuck here in their throats. And my wife she'll comment on this as well, but they get tubes in their stomachs. Oh,
I just want to quickly say to the person who's saying they had MS, you're likely immunocompromised. On steroids, maybe not. I don't know what your medications are, but if you have MS, speak to your doctor taking care of your MS. Like, we're just saying, everyone should get it that can get it. And if your MS doctor said it's better, but don't anyone in here that may have MS, don't run and get a shot because you heard that, talk to your doctor. Because people who are immunocompromised, some of their specialists may say don't get it. Okay, I'll shut up.
Okay, so Marta C says she has balance problems and vertigo when her magnesium is deficient. So is that something that you've heard of?
Does she have?
Magnesium deficiency. Did she
No.
get? You don't get vertigo or dizziness?
I've never seen that.
My wife says that she's never seen that. I don't take care of enough of those patients, but again, anything is possible. So, she needs to talk to her own doctor.
Okay, I'm just I'm trying to find questions for you guys before we get out of here. I don't want to miss anybody. Okay, so let me tell you what Kels just said about, I'm just making sure.
I just want to quickly say to you, looking, my husband jokes, my wife will correct me. And again, I sound smart because I have to know a little bit about a lot of things. But when it comes to saving your life because you're bleeding out, or major drug, he really, I don't even try to pretend that I can do what he does. He's just, you come to me and you have reflux and you're healthy, I'm going to put you on Nexium or whatever. But if you come to me and you're still having reflux through those medications, I'm going to send you to him. And he's going to do the scope. He may find the cancer. He'll take the cancer. We just different fields. So he's a very good doctor. Not that anyone is going to go see him, but.
Well, I'm about to come to Michigan. Kels is saying that her brother had a sledding accident. That's why he got that. He's had multiple operations. He's had no feeling in the lower right leg, and he can walk with a brace. Remember, her brother's the one that got the
Guillain-Barré.
Yeah.
Yes. Okay.
I mean, honestly, it could be a lot worse, Kels. And I'm not minimizing what happened to him at all. It is horrific. It's horrible. But I don't think I've seen anyone walk after. I mean, I've had, yeah. So, I mean, maybe it took him a while to get to that point. I don't know, but I mean, he could be in a wheelchair for life. So thank God he can at least walk with a brace.
Yep. Okay. I'm looking at $3 wig. She changed her name to Deadly Sin. I'm going to have to remember that now. I got so used to $3. It was $3 wigs from Walgreens. It was $3 wig. And now she's Deadly Sin. Got it. Okay. She said the nerves in his lower right leg are all dead. That's what Kels is saying.
Yeah.
That could be from the trauma. It's hard to tell what level of the spinal cord was injured or what exactly happened based on the accident.
Well, it's not bilateral, so.
Usually Guillain-Barré is bilateral, correct?
Usually
He's
it is.
Spread up his back now, on his right side now. He sees a specialist at Mass General in Boston.
Oh, he's in good hands.
Okay.
He's in good hands.
Deadly Sin said that she's scared to take the COVID vaccine because of all the stories. Dr. Sasha and Dr. Melanie said that they encourage everybody to take the vaccine who's capable of taking it, because if you get the virus, it'll be a whole lot worse than the chances of you actually having a side effect from the vaccine. Am I correct?
The stories of the virus.
Perfectly said, Heidi.
Exactly. And the stories of people having the virus are worse than the stories of the vaccine. Trust me, we've seen it personally.
Okay. Snuggle Bunny says she takes whatever that damn word is. I'm not even trying it.
Ibuprofen?
No, Tysabri. Tysabri is a biologic agent that's used sometimes, most of the time, I think it's used for multiple sclerosis. And correct me if I'm wrong, but we use it. I use it occasionally in patients with inflammatory bowel disease, Crohn's disease. I don't use it a lot because it's got a lot of side effects. From my standpoint, it may work for whatever she's using it for. Yeah, Dorothy, whatever she's using it for, and that's perfectly fine. I don't know what's going on, but it's a biologic agent. It suppresses the immune system, and it, you know, I mean, it's actually a good medication for MS patients if that's what she's using it for. That's all I know that it's used for. But tell me more.
Okay, so is it true that you can still get the virus if you get the vaccine?
Yeah.
Okay. No, it's not. No, hold on. That's not what she said.
She said, I heard stories that they get the vaccine and they get COVID.
Okay. First of all, let's be clear about this. You cannot get COVID from the vaccine. That's number one. So don't think you're getting COVID from the vaccine. It is a dead virus that you're being injected with. You cannot get COVID from the vaccine. It is 95% effective in stopping you from getting COVID. So there's still a chance you can get COVID. Small, but there. Well, I mean, think Johnson & Johnson's like 89% and Moderna.
It's just like getting the flu shot, right? I mean, there's always a chance of you getting a different strand, even if you get the flu shot.
It's different in that, like the flu shot, first of all, it's only about 70% effective. And there are so many different strains, and they only test for the year of what will be the most virulent or dangerous variant. So when we say you can still get the flu, you have a 70% chance of, 30% chance of getting one of the really, really bad ones, and a 70% of not getting them. But then there are some that are not contained in the vaccine.
Okay.
So then you're not, you're just going to get a flu, but it's not going to kill you, hopefully.
Okay.
And with COVID, the difference is, well, now we have the Delta variant. So there's only two. Luckily, this covers the Delta variant, the one we have now. But the effectiveness, if you think about it compared to the flu, it's one of the highest effective. 95% is huge. Probably one of the highest of all the vaccines we have. But you can still, there's a tiny percent. Again, it's not 100% effective. And depending on which one you get, I think Moderna is 93% effective or something. But you will not be hospitalized or die from it. So yes, you can get the vaccine and still get COVID, but it will not be as severe. And no, you cannot get COVID from the vaccine. Right.
Okay.
No,
Gwen wants to know, do back pain cause leg pain?
Absolutely. I mean, the back pain doesn't cause it. It's a nerve coming out of your back. Those nerves in your lower back that come out of the spine. It's like a disc will press on the nerves that come out, and those nerves innervate the leg. That's what just happened to me, Heidi.
Yep.
I initially only had leg pain. My back didn't hurt. And then later my back started hurting, and then everything went wrong. But yes. And again, you can just
Kel says her fiance has Crohn's disease and he gets Remicade infusions. Okay. Crazy Cat Mama is saying thank you for allowing them to ask these questions to such amazing doctors tonight. and sometimes they don't feel like talking to their own doctors.
I understand that. That's why, we were wanted to do it.
Yeah.
We're like nerdy people like that.
Yeah.
We think medicine's fun.
To Kel's, Remicade is a very good
Yeah.
treatment for Crohn's disease. It works. And I just started somebody on the generic version, which is infliximab. And in 5 days, that patient has gotten a whole lot better. So, good luck to your fiance, and hopefully he'll get better ASAP.
Yes, guys, thank you. We went through all the questions.
Oh, good.
Good.
Oh,
That's good. An hour and a half. And
I
I'm gonna
want
go
to.
watch
You
this.
guys are the best. Thank you. And don't
Oh.
send me no bill. Don't send me a bill.
Oh, it's coming.
You are so funny. No, really, it was our pleasure. And I hope I'm glad we got everyone's questions answered. And someone has, really thought of something they want to ask and forgot. You can tell how you
Yes,
feel.
guys, if you forgot, send me an email or just hit my DM. But my email address, so I'm going to put it here in the chat for you right now. You can send it to me, and I will make sure that Dr. Melanie and Dr. Sasha gets your question. And they will contact you directly.
Yeah.
I really, you guys are getting such high praises. My goodness.
Oh,
Well, thank you very much.
that's so nice.
No, thank you guys. I really appreciate it. And Melanie, Dr. Melanie, I call you Melanie.
Oh, please.
Dr. Melanie, I need you to get a whole lot better and take
I
care
know.
of you. And
I
Sasha,
know,
you're
and
doing a great
I
job. If
should
she
have said
doesn't
it
listen
first.
to
I
you,
apologize for talking to a circle,
look,
giving medical advice, but I mean, you'd get another disease if you had to look at me. So
yeah, but
She's
Dr. Look, how does
beautiful.
it say?
Always beautiful.
It
My
says,
beautiful
physician,
wife.
heal thyself, and you're not doing that, so you better behave yourself.
no.
But
And
I
how
want
fit is Dr. Sasha?
yes, I want to
Isn't he?
say thank you. You guys are just wonderful, and
Oh,
everybody
yeah.
in this chat is saying such wonderful things about you guys, and I
Oh.
really appreciate you taking the time out to do this. Tomorrow night, guys, we're going to be on. I have a really special guest coming on with me. We're going to be discussing the case of Stacy Stites. Rodney Reed is on death row here in Texas, and he was granted an indefinite state of execution, which is unheard of in the state of Texas. So we're going to go through the case.
Yeah,
We're going to look at, what they did wrong. We got it all put together for you guys. And the person that's coming on with me is a relative of the person that they're looking at now for the murder itself, the rape and murder of this beautiful young woman.
What
So,
time, Heidi?
Tomorrow night, we're going to go at 7 Central, so 8 your time.
Okay,
Yes.
good.
Okay.
Yes.
I heard about that. But I don't know what's going on, so I'm glad you're doing it.
Yes. So Rodney Reed, if you guys are not familiar with the case, look it up. But I have, my God, I've dug and dug and dug, and I put it all on a beautiful PowerPoint so you can follow along with us. And she's here, and this happened in Bastrop, Texas. So it's going to be, and he's right there in Livingston. So he's like 30 minutes away from me. And when I talked to my boyfriend yesterday, he was like, yes, he was on the same wing when he was a corrections officer. So he knows exactly what.
Oh, wow. Okay.
So
We'll be
that's
there.
what I'm doing tomorrow night. Tomorrow's Wednesday. Then Thursday, we have cocktails with me and Debbie. And we are going to go over So Freaking Cheap.
Don't forget your bonnet.
Yes, we're gonna go over So Freaking Cheap. We're gonna talk about Smothered, which I'm about to go smother somebody. And we're gonna just get into a little bit of the housewives. We're gonna discuss Bill Hutchinson with his new charges in California. It's gonna be fun.
Don't forget your bonnet and coffee.
Oh, yes, Thursday morning, girl. Bonnet and coffee, 9 o'clock Eastern, 8 o'clock Central. It's on the Deary Vet Says channel, and we do this every Thursday. But last Thursday, we took the week off. She had some things she had to do, so
It's a good. Oopsie.
yeah. I just want to say thank you guys, and guys, I am now over. Ooh, I'm excited. No, I can't even say it because I don't want to jinx it. But anyway, we're moving up, and I'm enjoying it. Thank you again, Dr. Sasha, Dr. Melanie. I really appreciate you guys. Love all of you. You guys have a good evening, and I'm gonna play this, and we're out of here. Bye, guys.
Thanks for having us.
No problem. Bye. Oh, bye. Cal's call me. Bye.